Hi, and thank you for joining us today for this discussion on the COVID-19 vaccine. My name is Allison, and I work in communications for the Vista Community Clinic, also known as VCC, and how you'll hear me refer to it throughout the conversation. Today, I am joined by a special panel of clinicians from VCC, including our Chief Medical Officer. Before we begin with introductions and dig into this conversation, I do want to mention to our viewers and listeners that this discussion is the opinions of medical professionals based on current guidelines and information available to us as of record date, April 30th. We do advise you to seek the advice of your own medical provider for questions specific to your own health needs. With that said, I'll hand it over to our lovely panel for some introductions and we'll begin our conversation. Can we begin with you, Dr. Fatland?
Oh, my name is Dr. Sarah Fatland, and I am the Chief Medical Officer here at Vista Community Clinic. I'm a family medicine physician by training and very excited to be talking to everybody today.
My name is Dr. Brad McCamick. I'm a pediatrician at Vista Community Clinic. And as Dr. Fatland said, I'm also very excited about this topic and this opportunity to have a discussion about this particular vaccine.
Hi, I'm Dr. Sujana Gunta, and I'm the Director of Pediatrics at Vista Community Clinic. And by training, I'm a pediatrician and a pediatric nephrologist, and happy to be here to be a part of this conversation.
Again, thank you all for your time. I do appreciate it. So let's begin with answering the question, who is eligible for this vaccine currently?
Now in the state of California, all individuals over age 16 are eligible to be vaccinated. At Vista Community Clinic, we have Moderna and Johnson & Johnson currently available, which is approved for individuals over age 18.
Thank you. Okay, so a consistent question we hear is regarding the safety and efficacy of this particular vaccine, and then also the differences between the vaccines that are available to us. Can you guys speak to those things for us?
Yeah, so currently there are 3 approved vaccines, and they are Moderna, Pfizer, and Johnson & Johnson, which is also known as Janssen. And like Dr. Fatland already mentioned, Moderna and Johnson & Johnson are approved for 18-year-olds and up, and the Pfizer vaccine is approved for 16 years and up as of now. Regarding the differences between the vaccines, the Pfizer and Moderna vaccines are messenger RNA vaccines. So these messenger RNA vaccines, they teach our cells how to make a protein or even just like a piece of protein. And this protein then triggers our immune system inside our bodies and then teaches us how to fight the virus. While the Johnson & Johnson vaccine is an adenovirus-based vaccine. It uses a disabled adenovirus to deliver these instructions to our body of how to build this spike protein and then again trigger our immune system. So those vaccinated this way gain protection without ever having to risk the serious consequences of the COVID-19 disease itself or getting sick with the disease. Those, I would say, are the main differences between the vaccines.
Does anybody want to talk about the safety aspects of the vaccine and maybe even discuss the pause that we saw with Johnson & Johnson?
Absolutely. So in terms of safety, any new vaccine or medication in the United States has to go through a clinical trial to ensure safety and efficacy and effectiveness of the vaccine or medication. And in the case of these 3 vaccines, they've gone through the typical safety and the typical efficacy measurements that going through any of the approval processes that previous vaccines and medications have gone through. In every phase and step along the way, safety is always a priority for every vaccine and medication before it can proceed to the next step, and especially before it can kind of proceed to the general population and become available to everybody. So in terms of safety of the 3 vaccines, the the three phases of the approval process. Phase 3 is where typically the biggest group of people are given the medication or vaccine, in this case, the vaccine. And typically these groups in prior times, range in the hundreds to thousands range of numbers. And the number of people that participated in these clinical trials is staggering compared to prior clinical trials, and approaches, it's actually over 100,000 people who participated in the clinical trials for all three put together. So the amount of evidence we had on the safety of these vaccines before they were released is massive, even compared to previous years. And that's attributed to the funding from the federal government that allowed, big, widespread and very fast development and recruitment. A lot of people interested in ending the pandemic and therefore volunteering for studies. So that's where all those really big numbers came from. So the safety was really, really tested thoroughly before these vaccines were released to the public. And now, we have about 25% or more of the adult population fully vaccinated now. So we have tens or hundreds, approaching hundreds of millions of people to also gauge further safety, which we're additionally screening for. So if anybody's worried about the safety of these vaccines, there's hundreds of millions of people who that we're looking to every day and have ongoing data for. Specifically, you mentioned the Johnson & Johnson vaccine, and people probably have heard that name in the news and are aware that there was a pause in giving the vaccine. There are 15 known cases that were thought to be associated with this vaccine of blood clots, but in particular people after getting the vaccine, which is obviously a concern, which led to the pause of the vaccine here in the US for a brief period of time. However, 15 cases out of 6.5 million doses of the vaccine, that calculates out to a 0.0002% rate of complications there. And that compares to a 2%, which by just quickly looking here, a 10,000 times more risk of dying from COVID, the infection, rather than having a complication from the vaccine. So we're always weighing the risks and the benefits of these things, and the benefits of getting this vaccine far, far, far outweigh the tiny risk associated with this. But ongoing, like I mentioned, ongoing research and ongoing tracking is always being done to make sure that these vaccines are safe.
Thank you very much for that very thorough answer. Dr. Fenton, is there anything else that you wanted to add to that before I move on to the next question?
I think as we're talking about safety, we also think about how effective the vaccine is, because we know that COVID had really significant health consequences for people, ongoing, many more deaths than were ever necessary or predicted occurred. And I know there are questions about how effective the vaccine would be. So when we looked at the initial data, we talked about Pfizer and Moderna being in the greater than 90% effective, and Johnson & Johnson being greater than 60%. And I know some people had questions about whether or not that meant Johnson & Johnson wasn't as good as Moderna or Pfizer. And it's really important to remember that the vaccines were studied at different points in time, and they were studied in slightly different ways. So you're kind of comparing broccoli and oranges if you're looking at comparing those percentages. As we have vaccinated more and more individuals, we're seeing that all three are incredibly effective at preventing COVID. They're also preventing hospitalizations and death. And so the most recent data shows that the case rate in people who have been vaccinated with any of the vaccines is not only less than 1%, it's less than 0.1%, it's less than 0.100%. So that is really, really strong data, especially as more and more people get vaccinated, that shows these vaccines work, and it's the key to getting us back to living our lives.
Thank you so much. Okay, so my next question for you is symptoms post-vaccine. What should I, as someone who hasn't been vaccinated, expect to experience? And can you speak at all to what that might mean? Should I be concerned at all about particular symptoms, et cetera?
So the possible reactions to the vaccine, the most common ones that have been seen, that were seen in trials, and now that we have, administered, several millions of vaccines, those findings have been substantiated again. So the most common are pain at the site of the vaccine, headache, and tiredness. You could also get fever, chills, and just myalgia, so this muscle fatigue, but all these symptoms are seen to last less than 48 to 72 hours. And the other thing that we are noticing is the symptoms might be slightly higher after your dose 2 of the vaccine as compared to the dose 1. But that shouldn't be a hesitation or a barrier to getting these vaccines at all, because we know that these vaccines are what we call reactogenic vaccines, which means that it is okay, it is common to have these symptoms after the vaccine. We also know that the symptoms are self-limiting, which means that they will last only for 48 to 72 hours. And I would say that is still a very good trade-off as compared to getting sick with COVID, where your symptoms can last for weeks on end. You are at the risk for getting hospitalized. You're at a risk of dying, risk of infecting your family members, and other such things. So yes, you could have symptoms for 2 to 3 days after the vaccine, but they're self-limiting, and so it shouldn't be of a concern. If your symptoms do last more than 3 days, and if you feel that you are experiencing anything beyond the headache, fever, chills, then you should definitely contact your primary care doctor.
Fair enough. Go ahead.
That if you don't experience any side effects, which many people won't, it doesn't mean that the vaccine isn't working. It just means that you're really lucky.
Very good point. Thank you so much for that. And I did experience personally, all the things that Dr. Gunsa mentioned, and they were gone after 48 hours. And I'm happy to say that I am fully vaccinated regardless of the symptoms I did experience. Okay, so in order to prepare for the vaccine, is there anything that I should do, or maybe more importantly, shouldn't do?
So yeah, I'll speak to this one. So I think what I am typically recommending, just because there are a certain number of people that may experience some of these side effects after one or both of their doses, is plan for that. You don't want to have to, work through something if you have control over your schedule, or the ability, or if it doesn't delay getting the dose by too much, but plan for maybe being a little sore, a little sluggish for a day or possibly 2. After the vaccine, if you're experiencing any of these side effects, it's absolutely okay to take some of these the medications, ibuprofen, Tylenol, pain relievers. We generally recommend before vaccines. We don't advise taking those because they do modulate the immune system in a particular way, and that might affect how effective the vaccine is. So we generally recommend, as I do to for my patients, not to take any of these medicines before getting vaccines, but as a result of some side effects that might develop later on, they absolutely can. Another particular thing to avoid for the COVID vaccines is that we recommend to wait 2 weeks or make sure that you have not gotten another vaccine 2 weeks prior to either of your doses. just because it may interfere with how effective the vaccine is or how your immune system responds to the vaccine. So, prioritize. Typically, we're saying prioritize the COVID vaccine. However, your particular case may differ. So always, this is one of those cases where we say consult with your clinician about what vaccines are more would be a priority, but the COVID vaccine, we should wait 2 weeks after any other vaccine before starting that series or getting the vaccine.
Thank you. Excellent information. I had a discussion with my friends who are all fully vaccinated now as well, and they just really weren't sure if they should take something beforehand or after or what that was. So appreciate that. Okay, so if I want to get vaccinated with VCC, do I have that option? Or do I need to be a patient? Or can you tell me about that?
Yeah, if you are a VCC patient, you can absolutely get on the schedule to be vaccinated. Right now, we have dedicated days and times for the vaccine schedule at each of our sites. Those can be scheduled by calling. They also can be scheduled by signing up for the portal and self-scheduling on the portal, which is a really great and easy way to get on the schedule. Those appointments tend to open up on Fridays. So if there's nothing available on the first time you try, certainly looking for Fridays for the new openings would be your next best step to get the vaccine at VCC. And of course, if you don't have a primary care clinician and you are looking for a primary care home, we would be happy to accept any patients and take care of all of your health needs, including providing the vaccinations that you're eligible for.
Great, thank you so much.
And just to add on to that, if someone, I've heard of people who do have a medical home that, but they're having trouble getting the vaccine, or in our case, we have the Moderna vaccine, and we have a number of patients, 16 and 17-year-olds, who are interested in getting the vaccine. There are some other resources available for people looking for the vaccine. CVS is one, and we're not sponsored, nor do we have any financial ties to CVS, but I know that they do carry the Pfizer vaccine. That is the vaccine that is available to 16 and 17-year-olds as well as older, but and I've heard that they are fairly available. There's another resource that I was just educated about yesterday, I think in a meeting with both Dr. Gunther and Dr. Fatland, about Vaccine Angels. There's a service called Vaccine Angels, and if you search Vaccine Angels San Diego, and that might even just be the website with a .org after it, but if you search Vaccine Angels in San Diego, there are people dedicated to helping coordinate you to get an appointment to get the vaccine, and I've heard that they're very, very helpful and have gotten people the vaccine fairly quickly.
Thank you very much. Okay, so in general, who gives me my vaccine when I come to get it? Should I be expecting anyone in particular?
All of our vaccines are given by trained health professionals who have a lot of experience in making sure the vaccines are given in the right location, the right dose, all of the right things that go along with vaccinations.
Good. And are there any, before we close this up, I do want to open up the floor to anything that I have missed. I'm sure there's so much information out there, especially as clinicians who see patients, our community members. You probably know of a lot of the conversation that can be touched upon. I'm sure we could go for hours, but are there any other things that you would like to make sure that we speak about or just make a comment on before we close up here?
I would like to talk a little bit about some of the myths that are circulating in the community, and how all of them are untrue, and hence the word myths. One of the most common one that I'm hearing is related to that it is not FDA approved, or the vaccine was made too quickly. And I want to point to, like Dr. McCamick had mentioned previously, that the vaccine is certainly FDA approved. It only has a tag of emergency use authorization because it is designed to work in a process in a quicker fashion because in a situation like the pandemic that we are in right now. And so it's certainly FDA approved, and also that a lot of resources were poured into this. And that's why, the timeline for the vaccine may be shorter as compared to other medications or vaccines, but certainly no steps were skipped, and the safety and efficacy was thoroughly tested before it was released to the public. Several other myths that concerns about that the vaccine may cause infertility, that it has some preservatives like mercury, or it may change your DNA. All these are simply not true, and unfortunately are being, propagated by individuals who are against vaccines in general. And I want you to go to trusted websites like the CDC, or just talk to your doctor about this if you have any concerns regarding these vaccines.
Excellent point.
I hear a lot, I don't need the vaccine, I'm healthy. And I think that's a myth, right? Because if you are healthy, you still need the vaccine. COVID doesn't care if you are obese. COVID doesn't care if you have multiple medications that you take every single day. COVID doesn't care if you're 16 or if you're 88. COVID has had terrible outcomes for people who are healthy. And so healthy people need the vaccine so they can prevent getting the disease and transmitting it to other people. People who have health conditions need the vaccine so they can avoid getting the disease and transmitting to other people. We all need the vaccine so we can help protect our hospitals and our healthcare workers and our community and our family and people that we live with and our friends and everyone else. So if you're healthy, if you're not healthy, you still should get vaccinated.
Just piggybacking on what Dr. Fatland just said, even if you have had the COVID disease, we still highly recommend for you to go get the COVID vaccine. We know that even if you've had the COVID disease, the immunity or the antibodies do not last as long as they would last after the vaccine. So once you have recovered from the acute phase of the illness, you are absolutely eligible and in fact recommended to still go get the vaccine.
Thank you.
And Allison, as you said, we could spend hours on this, and if you don't keep us in check, we probably will. But I did want to talk about one thing. So when I talk about vaccines with my patients, in general, vaccines help us, but they also help the people around us, just like Dr. Fatland was saying. And this in particular is it's extremely important for us to reach a certain level of vaccination before we can get back to normal, which I know everybody wants to do. And that kind of magic range is between 70 to 80% vaccination before we can reach what's called herd immunity, which that's kind of when we can stop the spread from person to person as easily for this particular, for COVID. And kind of let and it will kind of burn itself out, so to say. But right now, the kind of interest rate of people who want to get the vaccine is hovering around 70%. That means everybody who's even considering getting it needs to get it so that we can kind of get to that number. So even if people are on the fence or going to get it or just haven't gotten around to it, like it's super, super important to get it. And in terms of the urgency of getting it, some people are thinking, oh, I'll wait. I don't have time right now. I'll see how many more, I'll see if it's still safe after more people get it. Like I mentioned earlier, almost 100 million people have already gotten it. Get it already, because it's proven to be so safe, like incredibly safe. And the longer we wait to get vaccinated, the more time there is for variants to pop up. And I know that we've been hearing about the variants. And while the vaccine is still effective against variants, so it's still really important, it seems like they are a little bit more resistant or a little bit more aggressive. So the longer we wait, the more chance variants have to pop up. So get it now, get it today. Sign up for one of the resources or your clinic. And the faster we get to that, the faster we can get back to normal. And the CDC every few weeks has been kind of coming out with a little bit more freedom for people that have gotten vaccinated. This past week, I can walk around outside without a mask if I'm not going to be close to people. And like how like how freeing is it to walk around without a mask now? Like it's such a small move, but little by little, and the CDC is not going to do that if people stop getting vaccinated and we're not approaching that number. So for me, for you, for everybody around you, just do it, please.
Thank you guys so very much. I will leave it there. Thank you for that last remark. That was a perfect way to end it. Again, thank you so much for your time. I know you're all busy people, so I do appreciate you sitting down with me and all of our viewers to talk about this. Hopefully we answered some questions, calmed some nerves, and got some people ready to get vaccinated. So I want to just make sure I mentioned before we stop, if you've experienced allergies to injectable vaccines or medications in the past, or have other concerns about receiving the vaccine, we do ask that you discuss with your primary doctor or allergist to review your options. Please seek proper medical advice. Also, if you have a comment after this, please go ahead and leave it below or send us a message. I am happy to reach out to you or any of these clinicians and answer whatever we can. So you can also reach VCC by calling or texting 844-308-5003, and I'll be sure to put that in the caption as well. Again, thank you guys so very much for your time. I do appreciate it. Have a wonderful day, have a wonderful weekend, and hopefully we all get vaccinated.
Thank you.
Thank you so
Thank
much.
Bye.
Have a nice day.